Medicaid has a whole series of diverse roles in the healthcare system today. Generally, the program provides comprehensive and affordable coverage to certain categories of individuals for low-income individuals in the program today. The financing for the program is shared between the federal government and the states, and the program also provides assistance to low-income Medicare beneficiaries, and Medicaid is also the largest payer for long-term care services in the country. Today, Medicaid, along with the Children's Health Insurance Program, provides pretty generous coverage for children, but the coverage levels for parents across the country are much more limited, and prior to health reform, states were really prohibited from covering adults without dependent children on their Medicaid programs. So the new law really expands coverage to all individuals, so sets a national floor for coverage at 133% of the poverty level. That will mean a significant expansion in coverage for adults in most states across the country, and by 2019 it's expected that the Medicaid rolls will increase by about 16 million individuals when the law is fully implemented. Today in the Medicaid program, we know from research and data that individuals enrolled in Medicaid have access to care that looks very similar to individuals with private health insurance, but some are concerned that with a huge expansion in coverage under Medicaid that there might be some issues with access to providers. To try to boost provider participation, one of the provisions in the new law would be to increase the payment rates for Medicaid primary care services and physicians up to the Medicare rates for 2 years, and the federal government would pay the full costs of that increase. There are also some other provisions like the financing and expansion of the role of the Medicaid and CHIP Payment and Access Commission that is designed to specifically look at payment and access issues related to coverage and expansion in the new law. Under the health reform law, individuals who are made newly eligible for the program will be guaranteed an essential benefit package or benchmark benefit package that will look like what individuals can get in the new health insurance exchanges. However, states do have some flexibility and can provide a more comprehensive benefit package to individuals who are newly eligible for the program. There are some provisions in the new law that would provide fiscal incentives for prevention and additional community-based long-term care. The states would get a little bit of additional federal financial support to provide prevention services without cost sharing and to take on some new options to provide community-based long-term care. Under Medicaid today, the financing for the program is shared by the federal government and the states. That rate of financing varies across the states, but on average, the federal government pays about 57% of the cost of the Medicaid program. Under the reform law, the federal government assumes a very large share of the new cost of coverage. For the years 2014 to 2016, the federal government will assume 100% of the financing for those whom are made newly eligible for coverage under the health reform law. And then that federal contribution will phase down to 90% by the year 2020.